Welcome to day 2 of the Virtual Lifespan Respite Grantee and Partner Learning Symposium. If you're joining us for the first time today and don't know me, I'm Jill Kagan with the Arch National Respite Network and Resource Center. I know that we're all still absorbing the great information and resources we received yesterday, and really looking forward to today's presentations. In reviewing the chat, we were really happy to learn about how you plan to harness all that energy and share best practices as you move forward with your Lifespan Respite grant activities. And of course, that is the purpose of these 2 days. Next slide, please. Again, for those of you who may not have been with us yesterday, I want to just really quickly review a few housekeeping tasks. Please keep yourself muted when you're not speaking. And if you find that your internet bandwidth is a little limited or shaky, you may want to turn off your camera when you're not speaking. But we do love to see you, so if you can keep it on, that would be great. Hopefully, we will have time for open mic Q&A today about midway through. But please feel free to go ahead and start posting questions or comments in the chat at any time, and we'll do our best to get to everything you need information on. If you get disconnected, just log back in with the link you received in your confirmation email. And if you're still having trouble, feel free to contact Marcia O'Malley. She's our wonderful tech guru. You can send her a chat message if you're in the system, or if you're out, you can text her at the number on the screen and in the chat box. And please, it might be a good idea to jot down that number in case you get disconnected and can't find your way back in. Thank you again, Marcia, for all your help today. Next slide, please. Just to introduce yourselves and get used to using the chat and to start talking, please take a moment and respond to this question in the chat box. We'd love to know about something that you learned yesterday that surprised or excited you, and why. It'd be great to hear from you on that. Next slide. Yesterday, we asked you at the start of the day what you'd like to get out of the symposium, and I went through the chat and summarized them on the slide here. Of course, all of you want new ideas and best practices. Specifically, you want information about how to provide respite in rural areas, best practices in emergency respite, innovations in community-based respite, how to best address the respite provider and workforce shortage. Some of you want more on performance measurement and measuring impact. And of course, there were quite a few of you who said you'd like more on how to strengthen your systems and improve networking. And I think that we got a very good start on this yesterday. We started off the meeting with a really excellent presentation, well, three excellent presentations from the federal perspective. With an energizing and positive message about the future of respite from acting ACL Administrator Allison Barkoff. If you missed that, I would really encourage you when we post the recording to go back and hear what she has to say about future federal activity around caregiving and respite. And of course, we heard from our wonderful federal project officers, Lori Stahlbaum and Sarah Vogler, who shared a lot of new resources with us, such as the Older Adults Equity Learning Collaborative and the Coordinating Center at the New York Academy of Medicine. That's going to be a very important resource as we hopefully move forward this year with talking more about cultural and linguistic competence in respite services. And Lori also shared the latest from the Raise Family Caregiving and the Supporting Grandparents Raising Grandchildren Advisory Councils. And that is going to impact a lot of the work that we do as well. And of course, much, much more. From the states, we learned about systems building, collaboration, and sustainability efforts in Arkansas, Idaho, Nevada, and Massachusetts, and about data gathering in Montana. Alabama, Colorado, and Virginia shared wonderful new caregiver education and wellness initiatives and resources. We learned about successful outreach efforts, especially during the pandemic, from Illinois, Oklahoma, and Tennessee, and even more. So I hope most of you were here yesterday to hear those presentations. And we have so much more to look forward to from you today. But most importantly, I think what these days do is provide for you who to reach out to if you hear something of interest that you want to learn more about, or if you have programs or resources that you want to share with a state that's engaged in similar activities. Our network is just so incredibly generous in sharing their knowledge and experience with peers, and ARCH is really proud to help facilitate that. So I hope you all will take full advantage. Next slide, please. Quickly to go over the expected agenda for today. It'll follow basically the same structure as yesterday, with bring, brag, and borrow at the center of the day. And for those of you who don't know about what that is, I'll be talking about it in a few minutes. A time for Q&A follows that, and then we'll have a self-care break. Following that, for some of us this afternoon, around lunchtime for those of you in the Pacific Coast, we'll have the good fortune of having Dr. Lauren Parker as our guest speaker. She'll be setting the stage for small group discussions we are going to have this afternoon on cultural adaptations to respite services and the ways that we identify and reach diverse populations in our communities. Again, as a reminder, all of the PowerPoints, the shared documents, other resources you're going to hear about today and that you heard about yesterday can be found at the link of the bottom of the screen. And Marcia's going to put that, oh, she already has put that link into the chat box for your convenience. Just quickly, are there any questions about today's agenda as we move forward? I don't see any, so let's move on to what I will try to make a quick ARCH update, but we have so much information we want to share with you about products and services that we're providing. We want to make sure that you're taking full advantage of those as well. So next slide, please, Marcia. Oh, you can go to the next slide, sorry. You may remember that in May and June, we circulated a training and technical assistance needs assessment survey that Ray Kirk put together for us. And I really want to thank you all for taking the time to complete that. I know it was a pretty lengthy survey, but more than 75 of you responded. So thank you. You provided a ranking of the issues you'd like to learn more about, as well as the TA formats that you prefer. We're still in the process of analyzing all the results, and then we'll have to run the final report by ACL, but I wanted to give you a high-level view of what we're learning so that you'll have an idea of the direction we'll take over the next year or two to meet your requests. And I think it was really compelling that so many of you really have the same needs and desires for information. The preferred TA formats, not surprisingly, are you all really prefer to have webinars with outside experts, because of course we love to hear from the experts. A lot of interest in our learning collaboratives, which is a great thing because they're all going really strong and we want to make sure you know about those. In-person meetings, and believe me, we are working on returning to those next year. Hopefully we'll be able to do that because there's nothing that replaces an in-person meeting. Our toolkits and guidebooks and manuals were also of great interest. In terms of topics related to the pandemic, and 80% of respondents ranked these as extremely or very important. The top needs in lifespan respite general areas, again, 85% of you ranked building respite systems and respite service delivery as extremely or very important. And then the next highest level of need was performance measurement and data collection and sustainability. Again, fortunately, these are all the areas that we have activities planned for you. But we now know that we're doing the right thing and hopefully meeting your needs. If you want to learn more about the first round of analysis that we did. It's summarized in a one-pager that Marcia has put in the chat as well. So you can take a look at that at your leisure. Next slide. Hopefully you're all aware of these major publications that we disseminated since the last Lifespan Respite Grantee meeting in June of last year. And you can find all of these documents at Arch Respite /products publications. The first one, In Support of Caregivers, was written by Susan Summers. She spent a lot of wonderful time initially reviewing all of your semi-annual and final reports and interviewing you when she needed more information. And the first step of this was producing the state fact sheets of your Arch activities and objectives. And from all of that, we came together and developed some inclusion criteria for what we would determine to be lifespan respite best practices. And so most of you are included in this document with specific activities that we really felt shine and highlight all of the great work that you do. If you haven't seen that report, it's again, you can find it on the Arch website. We also released last summer the completely updated volunteer respite manual that we first published in 2012, I believe, but this document includes all updated links and some information related to the pandemic, as well as lots of new volunteer examples. People who use this have told me it's a really wonderful resource, not only for volunteer respite services, but for generally providing respite services. So I would urge you to take a look at that. Both of these documents, we do have some limited hard copies. So if you prefer to have something in your hand that you can flip through, please let me know. I think the volunteer manual, I think we've already sent to quite a few people. And those of you who indicated interest in the key accomplishments report, but let me know. We can't send you lots of copies, but we can send you 1 or 2 or 3. So just let us know. The federal funding and support opportunities for respite was updated this past year. This is a very valuable document, especially as you're thinking about what agencies should we maybe be partnering with in our state, and that would be those state agencies that administer some of these federal funding opportunities. Not all of them support respite in every state, so it makes it even more important for you to be knowledgeable about what the potential funding sources are and where they might be housed in your state agencies. So it's also really helpful if you're exploring how to identify funding sources to sustain some of your services or to help family caregivers pay for respite. And that's available on the website. Next slide. These are the 2 wonderful documents. We did a lot this past year, I have to say. Thank you, my Arch team, for all this great work. In the respite research area, we did a summary report of the Arch Respite Research Summit that we held last fall. We just had some wonderful input at the summit and wonderful discussions. We captured all the highlights of those discussions in this report, and it's helping us advance our respite research work going forward. We also updated the annotated bibliography of respite and crisis studies, and we continue to identify the limited research that is out there that documents outcomes for family caregivers, for care recipients, for families, and for systems. So if you ever have a chance to take a look through this, that's also available on the Arch website. Next slide. And then, of course, I hope most of you did see the guide that we produced. I think it came out right after our grantee meeting last year, the National Voluntary Guidelines for Providing and Using Respite Safely During the Pandemic. The wonderful thing about this guide is that it also includes decision guides for respite services to help them decide how and when to open or provide services safely during something like a COVID-19 pandemic, as well as a decision guide to help family caregivers decide if they safely can use respite, and hopefully to make them more comfortable about using respite safely in difficult times. And we know how important respite was to many, many family caregivers during the pandemic. And then to complement that, we did, I think it was 7 or 8 case studies of services in our network that did open safely during the pandemic, and they worked with us. We interviewed them all and wrote up their findings of all the steps that they took to plan for and open their respite services. So thanks to all of you who participated in that. And we're very grateful to have those case studies. And as we need them, we'll continue to do similar studies. Also, I just want to mention that the National Voluntary Guidelines and the decision guides are now also available in Spanish for you. Next slide. One more important thing about that is that we are going to be, over the next month or two, updating a lot of the information in the guide for opening services during the pandemic, because there has been, of course, a lot of new information as things begin to open up, at least for now. So you'll be getting emails about that as we continue to update that information. Our learning collaboratives. This really, for the past year, has been at the heart of what we're doing, because we heard you that these learning collaboratives are very important to you in terms of gathering information and knowing who to talk to. And so we have focused on the first 3 learning collaboratives. The first one, performance measurement, is facilitated by Cassandra Furman. She's really a guru at data collection and evaluation. And this collaborative meets quarterly. Correct me if I'm wrong, Cassandra, I think that you said the next meeting was September 23rd. If you'd like to join the collaborative, please email Cassandra and she'll make sure you get the information about the next meeting. You can also access, for each of these, at that link, you can access recordings of past learning collaborative meetings and any resources that were shared. The Sustainability Learning Collaborative has been meeting for a couple of years now, and it's really morphed into more of a very small work group. There are about 5 or 6 states that meet monthly to share their updates on their progress and sustainability planning. And it's a very loyal group and a very active group. Susan does a wonderful job at facilitating and providing really meaningful resources to help stimulate discussion. So I would encourage you, if you're interested in participating in that collaborative, to please join us. People are, as I said, very loyal and attend all of these monthly meetings. It's the 4th Friday of every month at 12 Eastern time. The next one, the Respite Voucher Learning Collaborative, has a slightly different structure. We actually, it's facilitated by some leaders from the network. I help out, but it's really led by Aita Stevens and Renelle Baker from Oklahoma and Tracy Kahlo from Lifespan Respite Washington. I think we've only met once or twice in the last 6 months, but we were engaged with the leadership from the folks at Oklahoma to do a pretty in-depth updated respite voucher survey. And those results have been compiled, and we're hoping to schedule a meeting to share those results with you. It was getting so busy in July and a lot of people away in August, that we may not get to it until September. But again, if you're interested in the Voucher Learning Collaborative, we have 15 or 20 very active states involved in that collaborative as well. And then we're thinking about starting a volunteer and faith-based learning collaborative. I've already heard from 1 or 2 states who would be interested in this, and it can be whatever you want it to be. You know, with your leadership, we'll follow your lead. Together, we'll plan the schedule and the way the collaborative is structured and run. So if you want, you can put it in the chat now or let me know by email if this is something you might be willing to participate in. We probably would only meet 3 or 4 times a year because you already have so many things that you need to meet about. But These are our learning collaboratives. Again, if you want to reach out to Susan for the Sustainability Collaborative or Cassandra for the Performance Collaborative, and you can reach out to me for the Voucher Learning Collaborative or to any of our collaborative leaders. Next slide, please. There are just a couple of overarching initiatives that I wanted to mention to you in case you're not aware of them. Next slide, please. You heard a little bit about this yesterday from Lori in her opening remarks. We have partnered, NASHP, the National Academy for State Health Policy, is the lead on this initiative over the overarching grant, but we are in partnership with the Respite Care Association taking the lead for this respite provider recruitment, training, and retention project. And as I mentioned in our discussion group, and Lori mentioned yesterday, we convened an expert work group, have developed a draft set of core competencies specifically for respite care providers. We ran those by our expert work group, all of whom represent national organizations that focus on direct service workforce, or our state folks who have really a lot of expertise in this area. We sent out the core competencies for public comment, and we're in the process right now of analyzing. I think we got over 200 comments to the core competencies. So we're really excited about looking at those. Once those core competencies are agreed to, the Respite Care Association's wonderful existing online training will be modified to make sure that it meets all of those core competencies, and then it'll be field tested in up to 6 states, possibly more states, because we're learning that we may have additional funding to do a few more states. There is a small amount of money that's available. If you're interested in being a pilot state, the application is open right now. The deadline to apply is August the 6th. I know that's not much time, but it's not too difficult an application. So I'd encourage you to take a look at it at this link. If you have any questions, you can reach out to me or to Lisa Schneider at the Respite Care Association of Wisconsin. Next slide. And then I just wanted to, again, many of you may be aware of our innovative and exemplary respite service initiative. We're working to build a registry of such services that will really help advance our understanding of respite best practices. We'd also like to encourage more research and evaluation of these services that could possibly lead to replication, to be able to inform the respite field and the public about best practices in respite services. And of course, just to help build and promote stronger respite opportunities for caregivers. For the last 3 years, we've done a national call for evidence-based and evidence-informed practices for services that appear promising or that are trying new service models or reaching underserved populations. And I want to thank some of you have actually applied. If you have a respite service that you're funding with your lifespan grant, or you have a respite service within your network, you have recommended them to apply. And we ask that you continue to do that so that we can continue to build this wonderful registry. And we can speak with expertise when we get asked about, well, what is the best respite model for serving kids with autism, or what is the best model for serving individuals with memory loss? And we can say with confidence that we've identified these models that are collecting good data, that have a history of providing services successfully over a number of years. And there are quite a few other criteria they have to meet in order to be recognized. So we can say with confidence that these are truly innovative or exemplary services. And you can read more about these. We just recognized 4 new services for 2021, and they're posted on the Arch website. Next slide. And then finally, our respite research initiative. I think most of you are familiar with this as well. We have formed a respite research consortium, which right now is a wonderful list of people, researchers, funders, advocates, service providers who are really interested in learning more about respite or conducting respite or funding respite services. And we do updates to that research consortium. We also, as you know, held the Respite Research Summit last fall that brought together researchers who had been working with us over the prior few years through this initiative to give us updates on their work and to come up again with some findings and recommendations that will affect the work that we're doing moving forward. And to help us move that work forward, we brought together more researchers and funders and advocates together in the Committee for Advancement of Respite Research. They've met one time to decide on their goals and objectives and to formulate how we're moving forward. So we will continue to meet with them, and the work, of course, is to advance respite research, to focus on linking promising respite services to researchers so we can collect even better data, and just to generally improving the evidence that we have to document that respite is a service worth funding and providing. And then finally, we also have a very strong partnership with the Break Exchange. And the Break Exchange is defined as, well, the Break stands for Building Respite Evidence and Knowledge. And basically, it's an international group of researchers, respite providers, agencies, and individuals who are committed to building a culture of evidence-based respite. It's really a global expansion of what we're doing at ARCH in terms of respite. And it's just been really exciting to identify respite models from around the world. And ARCH has been co-hosting with the Break Exchange webinars that highlight new respite research that we learn about in other countries, or really innovative models from other countries that we are hoping to link with other researchers and continue to collect better data. Next slide. I want to make one more plea for those of you who know about our history of providing and offering the Lifespan National Lifespan Respite Conference every year. We always do it in collaboration with a state respite coalition or a state grantee. We've been partnering with a coalition, I think, since 1998 to help host the conference. And we really depend on our state partners to help us move this event along and to be able to, we would not be able to hold it every year if we didn't have a partnership at the state level. We do have one possibly interested state in hosting next year, but in case something happens and they haven't finally committed yet, I'm still looking for states that might be interested this year or the year after. So if you are interested, please get in touch with me as soon as possible, and I can share more details about what's involved in doing that. But for those states that have partnered with us before, I think they would say it was hard, but it was worth it. So just let me know if you have any interest in that. And I think that's the end of my presentation. Do you want to go to the next slide? Again, you all know how to reach me, but here's my contact information again. And I wish we had more time. At some point, for those of you who are really new and now you're completely overwhelmed and lost on how to find these things, we're working really hard at trying to set up a more formal orientation for new states that hopefully we can offer to you in September. But feel free at any time if you need to find something on the website or you need me to point you in the direction of a resource, please don't hesitate to reach out. Next slide, and I think we're ready to, I even finished on time, I can't believe it. We can move ahead with our Bring, Brag, and Borrow, which is, of course, for so many of us, the highlight of the day. If you weren't here yesterday, I'm just going to share quickly again how this Bring, Brag, and Borrow session works. Each state has identified one person who will share a Lifespan Respite grant or coalition highlight from the past year. I would once again make the plea that this is meant to be a rapid fire approach so we can get to as many states as possible, and asking you please not to exceed 5 minutes I know everyone wants to hear every word that you have to say, and everything you have to say is so important. I didn't want to cut off anyone yesterday, but we do want to be respectful of your time. So if you can keep it to 5 minutes, that would be wonderful. And this really rapid fire approach is meant to give you all a chance to show off a significant accomplishment and really encourage you to follow up with your colleagues. I mean, this is what our networking is all about. If you hear something you might want to replicate in your own state or to share a similar experience, we've also made available the participant list from today. Everyone's contact information is also available on the Arch website, or you can reach out to any of us at Arch if you need to find someone. Again, the link to all the PowerPoints and the resources that states so generously have shared these 2 days are on the Arch website at that link. The schedule for today, we pretty much grouped the presentations into these 3 topics, and we'll proceed according to the schedule. The schedule, if you want to have a quick reference to it, is also posted in the chat. You can take the schedule if you want to print it out. There's a column, the last column, that lets you jot down the name of the presenter who caught your attention, or if you want to take notes on that sheet so you'll have it for later to follow up with them. You can print it off off the chat right now, and it was sent to you as well. When everyone's done presenting, and again, this is the other reason we want to leave enough time so that you can actually ask some questions of your colleagues today before you forget and while you have their attention. So let's move along so we can take advantage of that Q&A time. If you are presenting, Marcia will be advancing the slides for you. So please remember to let her know when you would like her to advance the next slide. And I think we can go ahead and get started with our first presenter. Oh, the first topic is reaching diverse, underserved, and working caregivers. And this is going to be really the theme for the whole day when we have our afternoon speaker as well. So our first speaker today is Dina Prest from New York. So it's all yours, Dina.
Great, thank you, Jill. Can you hear me okay?
Yes.
Wonderful. Okay. So hello, everybody. I'm Dina Prest. I am the Lifespan Respite Project Director at the New York State Office for Aging. I also oversee and manage the National Family Caregiver Support Program that's in 59 area agencies on aging. And our 17 state-funded caregiver resource centers. So I'm representing our New York State team today, but I'd be remiss if I didn't mention my colleagues that are here with me, Jen Rosenbaum and Abby Lavazzo, who both work at NYSOFA on the programs I mentioned, and Doris Green, the director of the New York State Caregiving and Respite Coalition. So New York would like to share with you all today our current efforts that are underway to better understand and support working caregivers. Next slide, please. So the New York State Office for Aging, in partnership with the New York State Department of Labor and the New York State Department of Health, issued a press release on June 30th, announcing the launch of a public-private partnership to survey businesses and their employees. So the state's encouraging employers to ask their employees to complete the survey. And this will help us in identifying the number of employees who are caregiving for a loved one and to assess what they need as far as working caregiver intensity, and then connecting them to supports and information. We couldn't have done this without the help and support of NYSERC and the University of Wisconsin's Cooperative Extension, who allowed us to use their workplace survey. And I will say they had a lot of patience with us over the last 6 months in getting it just right for New York. So the survey is going to be opened up for 6 weeks, and we're excited to see the data once it's complete. Next slide, please. So for those of you who participated in either last year's Spring Brag Borrow, or you may have attended our workshop at ISBA last month, you may already be familiar with this new resource that New York has, but I thought it was still worth mentioning for those who maybe don't know about it. We developed the New York State Caregiver Guide for Businesses. And last year when we spoke about it briefly, it was still in draft form, but I'm happy to share with you today that it is finally complete. And we actually decided to add a fact sheet resource that just really kind of calls out some of the statistics and is I think a real eye catcher. So for those that are seeing this for the first time, I thought it would be helpful just to share a little bit about how this came to be. So one of our objectives in our current lifespan respite grant is to expand the workforce initiative with businesses and supporting working caregivers. And coincidentally, in 2018, there was legislation passed that tasked NYSOFA and the New York State Department of Labor with developing this caregiver guide for businesses to help support working caregivers across the state. So a state level work group was formed, and we worked really hard at developing the guide. The work group members consisted of the State Office for Aging, the Department of Labor, the Department of Health, and we actually pulled in the Workers' Compensation Board. They administer our paid New York State paid family leave program, and then of course NYSERC. So the caregiver guide has been designed, this caregiver guide for businesses has been designed to support New York's businesses, community and employed caregivers by providing relevant information on how to best support the working caregiver. The guide includes links to programs, supportive services, workplace data, and of course, information about the New York State paid family leave. So within the current grant, the core team plans to actually develop some additional supportive materials, such as informational brochures for businesses to disseminate to their employees that are working caregivers, and materials for the core team to use in informing businesses about the availability of the guide and accompanied resources. So you'll see here, we included the links so that you can access both the full guide and the fact sheet, so that you can look it over with more detail. And that is all I have. So I hope I stayed within my 5 minutes, Jill.
That was perfect, Dina. Thank you so much. Great information in 5 minutes too. We'll now turn it over to Mary Welts in North Dakota.
Good morning. As Jill said, my name is Mary Welts and I work with the Family Caregiver Support Program, and I also administer the Lifespan Respite Care Grant. Perfect. Okay, in North Dakota, we knew that we wanted to do some work with our Native American elders. So we reached out to the National Resource Center on Native American Aging, which is housed at University of North Dakota School of Medicine and Health Sciences. And one of the first things that they said to us was, we have a project that's just great for you. So Marcia, if you can just scroll down a little bit, right there you see that they had developed a Native Elder Caregiver curriculum. And as a part of this curriculum, they were hoping to make this an online, available online to people, but they didn't have the funding and the resources to do that. So Marcia, you want to just go ahead and click into the curriculum. And if you scroll down, it says, watch the module. Perfect. And I'm not going to spend a lot of time going through this module, but just kind of briefly talk about, just kind of go through it. So do you want to just start clicking through it, Marcia? Okay, next screen. If you click on the feather, it's kind of how you can move through it. Yep. This one is this module is designed to allow caregivers to engage with this by doing it at their own speed and at their own pace. And the intent was to focus on assisting family and community members who have responsibility of caring for their elders. Next screen. This curriculum was developed with an awareness of tribal reservation communities, as well as a mindfulness of the historically rich traditions and strengths of American Indian nations. The next screen, please. I'm going to read this screen actually. American Indian elders are valued members of their communities and most prefer to remain in their own homes and their own communities. This module provides guidance for caregivers who are family and friends. It is guided by an awareness of the modern context of rural tribal communities, as well as a mindfulness of the historically rich traditions and strengths of American Indian nations. Next screen. I also liked this screen, so I'm just going to take a minute to go through this one. The season of aging is a normal developmental process. According to long-held traditional values, American Indian people have the strong cultural perspective that honors elders and their wisdom. Traditionally, Native people viewed life as a circle of seasons, a circle of physical, mental, and emotional, social, and spiritual dimensions. The season of being an elder is the most important one along life cycle. According to Native cultural traditions, the definition of an elder is one who has received gifts from the Creator along their life's path, and who then generously share these gifts with others to help them. So, Marcia, you can just kind of keep flicking through the screen, and we'll just take a look at the curriculum. And then I think just before the very last, before it says resources, if you just want to stop at that screen. But I think part of the intent of this curriculum was to provide that education. We hear often about how caregivers don't always know what is happening with the people they're caring for. So what they've done is they've put together this curriculum that talks about both the physical as well as the sensory changes in just basic common verbiage that's easy for people to understand. And then along with the curriculum, they offer supports and ways to help people as they're working with their elders. There's going to be sound that's going to be added to this as well, and they're hoping to have that sound added by the end of August, which they feel will really enhance the curriculum and how it helps support caregivers and family members on the tribal nations. So you can see, just as Marcia's clicking through it, it's just good basic information that's easy for anybody who's caregiving to understand, with the end result and the goal being the more we understand about what's happening as we age, the more comfortable that we will be in providing care to people as they age. And then this screen kind of is kind of the closure screen. Caregivers can also feel confident providing care because they are better able to communicate with their loved ones and successfully help them remain in their home setting by creating the safer environment. So all of that information is just kind of brought back to, that's the purpose of what we're trying to do with this curriculum. Elders, caregivers, and healthcare providers can and should work together to maximize daily function and comfort. It is essential to respect the needs of our elders and their caregivers, showing and providing respect, generosity, compassion, and fortitude as we all journey through life's seasons of aging. So we're really happy that this is a curriculum that will be available for anybody. You can all just go to the NRCNAA website and we'll have access to this curriculum. And then the other thing that we wanted to share from North Dakota was maybe you guys remember last year we put together a 2.5-minute video on the importance of respite and caregivers caring for themselves. We had a lot of positive feedback on that video. So what we decided to do was move it into a PSA form. And we were pretty excited about the results of the PSA. We ran it for 3 months. We ran it September, November, and in May. And it cost $5,000 a month. So it was a total investment of $15,000, which ended up being an economic value of $186,000. So we feel it was a pretty good return on the investment. It was aired 11,401 times. And then I'm such a flake. I got I'm on vacation, you guys. I'm sitting in a cabin in the middle of Minnesota Lake Country. So it's I'm winging it here. But I have the TV and the radio stuff turned around. So we do not have 63 TV stations in North Dakota, but we do have 63 radio stations. And on those radio stations, it was aired almost 9,000 times. And like a lot of small states, a lot of really rural communities have their own little radio stations. So we were really, really pleased with that. We knew that we were reaching a lot of people in a lot of really rural areas with that number of airings on radio. And then on TV too, I mean, with 2,400 times it was aired on TV, and it hit all of our 19 networks in North Dakota. So the link to the PSA is there, and then I've got the link to the video there in case people would like to view that again as well. So that's it from North Dakota, or Minnesota, where I'm sitting right now. Thank you.
We were going to show that little video. Would you like us to show it now? It's only 30 seconds.
Oh, please. Yes, I'm sorry, my bad. Yeah.
Caring for friends or family members who have disabilities or chronic or terminal illnesses can be exhausting physically, emotionally, and spiritually. That's why it's important to care for yourself. Respite services can provide that brief, beneficial break from caregiving. This help is available to families and caregivers providing ongoing care to individuals of any age. To learn more, visit carechoice.nd.assistguide.net. We are here for you, so you can be there for them.
That was wonderful. It was just as good as the longer version. Thank you, Mary. Next, we have Nicholas Julian from South Carolina.
Good afternoon, everybody. Nicholas Julian with the South Carolina Respite Coalition. And just going to talk to you real quick about some effort that we have going on defining, identifying, and reaching underserved areas. If you could just go to the next slide for me. So it's very easy for us to be able to just say, rural areas underserved because the nature of a rural area with less resources and availability of things. However, with South Carolina, we have 31 of our counties out of 46 are considered rural. So you can see that makes it a very large target for us to just be able to simply say rural communities are underserved for us. So what we did is we identified some different attributes that we could possibly use as data points to start narrowing that down. And one of the things that we used was some previous internal data on where we have been placing some of our respite vouchers. So taking those county by county and then lining those up with some other agency data, such as the Department of Disability and Special Needs, identifying where their consumers are located throughout the state, taking all of that data and lining it all up to be able to identify where there's high populations with low usage rate of our respite vouchers, in addition to availability of physicians, skilled nursing facilities, hospitals, urgent cares, and so forth. So once we were able to compile all of that data, we were able to start identifying some entities and groups within those counties that we would be able to disseminate information to that could then help pass that along on our behalf. So through this assessment, we identified approximately 70 physicians and entities in some of the most rural areas that have previously been underserved, but yet had a higher population of caregivers. And we identified about 7, and we created some infographics and posters and information to be able to disseminate out to them for that. If you could go to the next slide for me. So a follow-up to this is we're going to be working with the University of South Carolina in August. Their Master of Social Work group is going to be helping us create a couple of surveys. We're going to do a statewide survey focusing on 2 areas. One, focusing on veterans, veteran caregivers and veteran care receivers and families. And then also looking at doing a survey among caregivers on the impacts of respite, and then also reaching out to employers and using that as an initial point of contact, trying to gather some of that information and then being able to follow up with those employers later on with another dissemination campaign. So this is some of the materials that we created. The poster we utilized with Clemson University with their mobile medical clinics. They placed those out there for us. And then our brochures, info cards, and we're also in the process of creating a 3-series video. Our first one should be done hopefully by next week, and it's an animated scripted voiceover, which so far looks like it's coming along very nicely. And then our second one is a physician interview about the impacts and value of taking respite. And then our last one is going to be a caregiver testimonial. We're going to compile all of them into one long 5-minute video. And then we also will have those 3 90-second segments that we'll be able to disseminate into different markets and different targets. So in a very quick nutshell, to stay on schedule, that is that.
Thank you so much, Nick. Great stuff in South Carolina too. And our next presenter is Tracy Kahlo from Washington. It's all yours, Tracy.
Thank you. Next slide. And hello, everyone. Good to be with you. I am also joined today by my fabulous Washington State partners, Dana Allard-Webb and Roz Albers. And she's new to the team, so please welcome her when you're in small groups. We are so glad to have her on board. And of course, my colleague in care and support, the lovely Barb Kunjan. So next slide. We are taking a focus, and I'm not going to read everything that's here, on equity, diversity, and inclusion and belonging. We went to a conference earlier this year in the nonprofit sector, and a presenter put the word forward that I love the most, which is belonging. So with that, next slide, please. We took a look, so on this slide, so again, Tracy with Washington, and I have about shoulder length, blondish, sort of light brown hair with freckles and blue eyes. And I'm showing a screen that has two graphs on it where we're going to be comparing data and talking about it very briefly, with a couple of images of the United States showing senior citizens and caregivers, as well as Washington State in a comparative, and then home broadband slide. So on the left-hand side, we compared Washington State, the US, and our Washington Lifespan Respite program by race and Hispanic origin. So national and state demographics are on the left-hand chart, and according to the United States Census records. So the chart to the right lists the data according to the Lifespan Respite program, with which Barb and myself administer for the state of Washington. And so we're using our total applications submitted from 2018 to July 2nd of 2021. The total number of applications is 758. Clearly not all those folks received a voucher. However, we're using that for our comparative data of today. So in doing that, looking at the chart on the right and the data generated by the Lifespan Respite Washington's total applications received since July 2nd, we can see that the Lifespan Respite Washington is serving Black or African Americans, American Indian and Alaskan Native, Native Hawaii and other Pacific Islanders, and those of two or more races who are caregivers and the person receiving care at a higher average than the Washington State Census data. But when we look at our caregivers and care recipients who are Hispanic and Asian, we see when we compare our Lifespan Washington data to the US Census for our state, we can do better. And we plan to increase, nurture, and expand our partnerships, outreach, and information on our website to do so. So we also wanted to take a look, and I'll explain why in a minute, to our home broadband, and we can see that it varies across demographic groups in the United States. We wanted to look, learn, and layer in this data to help us with our next steps. So according to the Pew Research Center that conducts their research of adults between 2015 and the present, we can see that the highest home broadband is 86% with 30 to 49-year-olds in the United States, followed by 79% for 50 to 64-year-olds, which gets into some of our caregivers for us in Washington, and then 70% of 18 to 29-year-olds, again, another demographic that we do have as caregivers. And then, of course, it went, unfortunately, lower to 64% of our 65-plus-year-olds in the United States having home broadband. So that's just a little over half. So when we look at our various states and layer in the next things that we've been talking about today, we see that for rural citizens, it's about 72% have home broadband, while suburban at 79 and urban at 77. These are all factors that we're all taking into consideration and talking about, just as Nick did before myself. And then that same chart divides it by race. So again, we looked at that to think about 80% of those who are white have home broadband, 71% of African Americans, and 65% of Hispanic and Latino. So next slide. Thank you, Marcia. So again, we wanted to inform ourselves because we are going to be using a grant provided by ACL, thank you so much, to increase our services and support and connections with those serving caregivers who are Asian, Hispanic, or Latino, primarily because of the data that we looked at, and of course, continue on and continue doing so with our African Americans, American Indians, and Native Alaskan Natives and Native Hawaiian and other Pacific Islanders, and those of 2 or more races. So one way we're going to do that is by offering mini tech grants with a priority for those that are serving the demographics we just outlined. And with those mini grants for technology, we hope they will purchase Zoom accounts, lighting, mail, pay the postage for care packages, and support caregivers. So I'm looking forward to the presentation. That's my 5 minutes. Thanks y'all to this afternoon, and keep on learning.
Thank you so much, Tracy. So much great information. The next topical area is service delivery. And our first speaker in this category is Alita Nelson from Arizona.
Good morning or afternoon, everyone. Can you hear me okay?
Yes, go ahead.
Thank you, Jill. And thank you everyone for sharing all the information that you have in your states. That's really exciting. And for the state of Arizona, we are starting the process of developing a statewide respite network. This was brought on by the fact that we are working on many different initiatives, including emergency respite and a few other projects with priority to underserved Arizonans. And just to give you a little bit of background on what Arizona looks like, we have about over 7.5 million residents in Arizona, with 60% in Maricopa County. So that tells you a little bit about how much of our state is a rural area, and we're home to 22 tribal nations. So you can see that service implementation for the Lifespan Respite Grant Program and the Family Caregiver Support Program can be challenging, just the nature of our demographics and geographical layout. Next slide, please. Next slide. With emergency respite services, there had been ongoing discussions about how to expand services for Voucher program and the adult day health center programs. Although those 2 services have been developed in partnership with the Arizona Caregiver Coalition. And I do want to brag for a minute about Yuta Oily, who is on the call today. She's worked hard with her team to help develop many different respite programs and to bring people to actually utilizing those programs. But, you know, in the framework of that, we realized that there were many other gaps in services for respite care in the state of Arizona. Right now, there's only 2 different contractors through the area agencies on aging that offer consumer-directed respite services. So we developed a respite advisory committee that is working on a work plan to address gaps in respite care services. Identifying those gaps really include the need for emergency respite, overnight respite, which is not readily available. You know, there is definitely that limited consumer-directed care model, and weekend respite care options were very limited or scarce in the state of Arizona. So working collaboratively with the Arizona Aging Network, there's been talks and discussions of developing the definition of what is an emergency. What is a true emergency? Is it planned surgeries? Is it planned out-of-town trips? You know, so that is definitely a discussion that is ongoing. We have process development, payment development, and services delivery, especially with consumer-directed care models. And then the subcommittees are working on development of forms for the area agencies on aging and other CBOs about how to do referrals, what kind of intake process that looks like. So really in the development of the infrastructure of how the emergency respite services will be implemented and going forward. Next slide, please. And once again, the Arizona Caregiver Coalition has worked on spearheading the development of the CBO mini grants. And, you know, everything from the application, funding announcements, and the application process and the selection for the award that, the subcommittee will be looking at here in the next couple of weeks and awarding the mini grants. The mini grant really is for respite care providers or, other informal organizations such as faith-based organizations that may wish to offer respite for an event or other educational respite care for family caregivers. So really looking at different ways to draw in other stakeholders, other partners, other collaboratives in the state of Arizona. Right now, we did receive the first application and we're in the review process of that. So really exciting to see how that'll work out. And they're really our guinea pig for the mini grant. So we'll see how that goes. Next slide, please. Networking, as mentioned, the Arizona, we're working on the infrastructure for the statewide respite network. There is a current respite advisory committee, and that really includes adult, protective services, Division of Developmental Disabilities, area agencies on aging, the VA, the Family Caregiver Support Program, and then 3 adult day health centers that are working on how to implement this. And then we're working on, expanding to invitations to other state agencies and coalitions, organizations to participate and then offer their input as to what is needed for respite care and for family caregivers collaboratively. And then also for, respite providers themselves, whether they're licensed or unlicensed, and how they want to participate. And really the ball is in their court as to how they wish to participate in the network. Are they just there for networking, information for family caregivers? Do they offer training? There's many different parts of this. So we definitely want to see this develop. And we're excited about the 3 projects we're working on in Arizona. Thank you.
Thank you, Lita. Lots of great new things happening there. Excited to hear about that. And our next presenter is, I believe James Davis from Mississippi is going to be presenting today.
Hello, everyone. How are you doing?
Great.
Great. Okay, I won't hold you long. You can go to the next slide, please. I think Miss Mary sent 3. The biggest thing that we found out about from our pilot program last year of our respite program here in Mississippi is we wondered, we had to sit down with the coalition and we was asking ourselves, what can we do to revamp the program? We were thinking like, wow, this is a great program, and a lot of people didn't sign up. Yes, most of it was due to the pandemic. A lot of people were apprehensive about letting you come in their homes. So, but we realized it wasn't that they didn't want it. It's we needed to ramp up our promotion. We needed a better marketing tactic to reach to others. They didn't know about the program. So we sat down with the media team and we came up with a cool new flyer, and it gave loads of information about who's eligible. How does the respite program work? There was a lot of questions that people had. Mississippi as a whole is pretty much a rural state. So a lot of people did not have access to the internet like we thought. But after doing the survey and getting the information, we came up with this cool flyer, and we did a small study. During last year, when this flyer was created, we used the old one that just was plain in a bunch of words, pretty much in a nutshell. Set it next to this one. A lot of people were more apt to grab the one that was more inviting and visible, and it was colorful. So now the program is growing. We do see an increase, and a lot of caregivers are being helped. Next slide. We even have a portion on the second page that comes along with it. It's about choosing a respite provider. So we actually guide them on how to choose a respite provider, because they can use a family friend. It could be an adult daycare or any type of agency that's willing to give that caregiver the relief they need. And with that being said, a lot of them were so appreciative about us taking this stance and really vamping up our volunteer program. The volunteers were so vital to us getting this information out. To disseminate all this information, you definitely need a strong volunteer core, and we're looking for more. But programs like this are very needed. Like, I'll give you a quick story. In 2010, my wife and I discussed this. If we would have knew about this, maybe in 2010, we could have used it for our own family. Because 2010, right when I got married, a forklift fell on me and took my legs from my spine. I was paralyzed for a year. And so we didn't make the honeymoon. I tried to make the honeymoon. I got hurt the day before the honeymoon. We didn't go. So couldn't go. But that was one income taken from my house. My wife was a full-time student. That was a senior year, last semester. She worked full-time, and now her husband is down. So she was the only care provider that I had, and we didn't know the resources that were out there. So programs like these are very much needed, and I'm glad that the media team and the marketing team really came up with an idea like this, and now we can see an increase in the program, and so many people are being helped here in Mississippi with this program. That's all I have. Oh, no, wait, one more thing I forgot. No, we have brochures that are coming along the way, so that was really cool what you had, South Dakota. We have our brochures that are coming that the marketing team are going to finishing up, and we're trying to contract with the local videographers to come up with our own Mississippi Lifespan Respite Voucher Program video as we are, promotional video.
Thank you, James. Wonderful. Our next speaker is Brandon Bowe from, excuse me if I'm mispronouncing that, Brandon, from South Dakota.
You are so good, Jill. It's great to be here. This has been a great day and a half so far. You know, we're 3 years into our life cycle here, and the things that some of the states have accomplished is just truly remarkable. And you guys give me a lot of motivation, a lot of inspiration that we can continue to build this program. James, I appreciate the shout out for our brochure. Very proud of that. So I just wanted to talk a little about what we do here. I work for the Department of Human Services here in South Dakota, and what we do is provide in-home services for a variety of things. But with Respite, we have 3 different programs that offer respite services. So with our Lifespan Respite Vouchers, we angle that more towards emergent and unplanned services. And it's been really wonderful because those programs, you know, are really well and good for people who just kind of want ongoing. But we have a lot of people that contact our Dakota at Home ADRC that need services right away. A unique issue that we have here in South Dakota is that we're just a rural frontier state. In fact, we only have 2 cities that are above 25,000 people. So in a lot of these communities where, you know, I want to say 50% of our communities are 2,500 people and less, finding respite providers proves to be very difficult. And a lot of providers have to travel maybe an hour, hour and a half to these communities to support the ones that need assistance. So the Lifespan Respite Grant has been great in a manner of connecting dots, making relationships between providers and communities. You know, and with that, we've done some really unique and fun and amazing things. For example, earlier this year, kind of a tragic situation, we had a woman call our ADRC and say, you know, my husband passed away very suddenly, very tragically. My parents are here. My mom has Huntington's disease, and I was not aware how progressed her disease truly is. And we're going to look for facility placement. But in the meantime, as I'm making funeral arrangements, as I'm trying to take care of my family, my children, get my life back on track, I need somewhere for my mom to go. So we found some institutional respite for her for a couple weeks. And that proved to be something that really balanced out her life. That was a quality of life improvement. And eventually they did locate some facility placement for her, but, you know, we were able to fill in the gap while this poor woman was, you know, going through the worst tragedy of her life. On a similar note, you know, we talk about lifespan. Something really awesome and unique that we were able to do is there was a woman here in Sioux Falls, is where I'm in. She had a double mastectomy while taking care of her 3-year-old daughter. Her 3-year-old daughter had some physical disabilities, some developmental disabilities as well, and was on a feeding tube. Well, because of the double mastectomy, she could not physically care for her daughter. And while her husband had to work, we were able to put a nurse in to assist with those feeding tubes, to just kind of take care of the situation. And we were able to do that for a couple of weeks while she recovered, while she regained her strength. So, you know, just a couple examples, and I'm sure undoubtedly that all of you have done incredible, amazing things with your own lifespan respite vouchers, but just a couple fun, interesting things that I wanted to note. Otherwise, yeah, we're just finishing up our 3-year life cycle. We're on to the next 5, and hopefully in a few years, I can report some incredibly awesome things and improvements as well. So great to be here. Great to see everyone. Thanks, Jill.
Thank you, Brandon. Our next speaker is Val Madison of Wisconsin.
Great, thanks, Jill. So Wisconsin, over many, many years, was really focused very much on hitting individual providers throughout the state. One change we did with this last round of federal funds that we received was looking at how can we bring respite programs to different communities. So instead of focusing just on let's train 1 or 2 providers in each community, can we build new programs so that they can provide respite to even more people? So we created a workshop, a 6-week workshop called Bringing Respite to Your Community. We had a max of 12 people, and we did, it was blended, so 3 virtual and 3 online at your own pace modules. We really used the ARCH volunteer respite manual a lot. It has, like Jill had mentioned earlier, it has some really, really good information, along with the ARCH website. ARCH really does an awesome job putting information together. So as we talked about program designs, I pointed them to the innovative programs, so then they can kind of see how different program designs are options and what might a program look like. There were assignments each week. So there was website and resources to review, pages from the manual to read, and then reflection assignments. With each assignment, obviously it was optional, but if participants did each assignment, they were really building their own business plan and being able to move forward in creating a great business program. So next slide. So we did the material presentation in a variety of different formats. We really wanted to make sure that we were reaching different learning styles. So we had some PowerPoint slides, so just basic presentations. I did some pre-recorded video lessons that on the weeks that we were not in face-to-face virtual, they would be able to see that video lesson. We had interviews with respite directors of programs throughout Wisconsin, some online reading materials. We had some discussion boards, the face-to-face meetings. We also offered one-on-one meetings with instructor. Some of our face-to-face group meetings ended up getting in the weeds with certain individuals just really, well, I'm having this issue, or let's talk about this, where we discovered that when we started doing the one-on-one meetings, we could do more focus on their individual programs, but then leave the big program or the big group meetings to topics that were important to everyone. And then we also brought in during week 4, professionals from an insurance agency and an accountant, and we're looking at possibly a lawyer our next round to answer questions about starting your own business. So each week we had different topics. The first week was really looking at needs assessment, program design, business structure, how respite works. And so that was an online based module. So they went through that information. The weekly assignment was to, what is your idea for a program? People really ranged in, they were starting a program to, I have an idea and I don't really know where to go. So we had this huge range of participants as well. And then really looking at how does licensing and funding work in Wisconsin? There's not a respite center license, so what do I do? So really working with individuals through that. Budgeting, documentation, policies and procedures. Again, the ARCH volunteer manual had some really, really good information around those topics. The insurance and accountant speakers talking about staff volunteer recruitment training, program culture, program eval, branding, marketing, and really had a final presentation at the end. So next slide. And so we had our pilot workshop in the spring. We had 12 participants. It went really well. So our next steps, where we're going next, is we're going to do a fall workshop with, again, 10 to 12 participants seem to be a good group to be able to have these virtual meetings. Our plan is to have 4 more workshops over the next couple of years. We also are contracting with a local university to do a follow-up with participants at 3, 6, and 12 months. So now you have this information. What else do you need to start a respite program? And we really did look at different designs. So there was a faith-based organization. There's people that were looking at volunteer respite, people that were looking at in-home respite programs, or community-based centers. So we really had a wide variety. But now we want to know, did you start your program and what do you need next? Or what's the next step for you? What more information can we give you? And then we're also hoping to create a toolkit that we're able to share with others, because this is just a really unique way to reach a bunch of different people throughout your state. And so we want to be able to share that. Obviously, the workshop that we're doing is very Wisconsin specific. We focus a lot on Wisconsin licensing and funding and how that works here, but we do want to share the information that we have. So we're really looking forward to following up with everyone and really hoping to get some great results and new respite programs built in Wisconsin. So that is all I had.
Thank you so much, Val. I really love this project. It's wonderful. I'm going to be really eager to see how many of those you trained actually develop new services and how long they exist. And then they can all apply to be innovative and exemplary. Okay, next presenter, I believe we have Alicia Blader from North Carolina. And the topic for our next 2 presenters is volunteer respite.
Thank you all so much. It's been really interesting to hear all the great things that everybody's doing. It will just be me presenting. Susan is having some audio problems, but she is here with us. This is sort of a bring. I guess we often have, brag and borrows, and, maybe you'll have some things you can borrow. We're a little bit new in what we're doing right now in this particular project. I wanted to talk, we can go to the next slide. I wanted to talk about an idea we had in our, in the phases of putting together for a volunteer respite consortium. And in our latest lifespan respite grant, our federal grant from ACL, we wanted to focus on volunteer respite and trying to come up with a way that we could foster and mentor people who were interested in providing a volunteer respite program or interested in growing their existing volunteer respite program. And we wanted that to be led by their peers. I think, we have sometimes a better opportunity to put that information out when it's coming from people that seem credible and relatable because they've been in the same business and doing the same things. So we're working on building capacity of that volunteer respite providers through a volunteer respite consortium. And we've modeled it around the Jewish Family and Children Services Percolator Memory Cafe Network. This particular Percolator Cafe, Memory Cafe Network is specific to organizations that are putting memory cafes together for caregivers and persons with dementia. But that network is an online resource. They have meetings that happen regularly. They have a toolkit. They have a place online where they post resources and information for one another. So that was kind of what inspired us or gave us a model to kind of look at this. And I know lots of you do something similar in your own work as well. But what we started out doing in this, before we ever developed the work plan and before we kind of continued forward with it, is we met with some organizations in North Carolina that were volunteer respite providers. They were organizations that their primary or sole service was actually setting up a respite program for caregivers, as well as caregiver services like transportation and companion friendship kind of care that's being offered. Neither one of the organizations has volunteer hands-on care that we ultimately ended up talking to have a contract with. And so we are in a situation right now in North Carolina where we have 2 organizations. One, as I mentioned, that is a volunteer, entirely volunteer organization that works in one of our largest counties in North Carolina. And they started with a faith-based model. It was started several years ago out of a conglomeration of churches. And then we also are working with another organization in another one of our large counties in North Carolina who has a model where they have volunteer services and they also have paid services. And so caregivers are referred to them and they find out, is it a service they can pay for, or is it something that they might need a volunteer for? And so we liked kind of having a variety of models. They are in the process right now. If we want to go to the next slide, you'll see here on our work plan in year one, we are putting together the actual contract. They will contract with the Division of Aging and Adult Services to actually start and oversee and grow this consortium. And so that gives us a way to start a new service that we're not actually having to oversee ourselves, but to involve a lot of peers and others in this network. So as state government, certainly we are very much around contracts and very much around what the tasks have to be and what exactly it is we're buying. So in their work plan, you'll see that in year two, key tasks, and this is certainly something that is available to all of you to look at, kind of our process of how we are thinking through this. But this, the leadership of these two organizations that will lead this consortium are also going to have a steering committee, and that steering committee is going to have 5 or 6 individuals that represent other volunteer respite organizations, as well as someone who is a caregiver who has utilized volunteer respite services. And so that is the design, that there will be a steering committee and our leadership team, and Susan and I will be going forward with it as representatives of the Lifespan Respite Project in North Carolina. And then there will be a process where the organizations are invited and they together kind of plan their curriculum of what it is they need, what sorts of information would help them understand more about adding volunteer components to the services they're already providing or growing their services. We knew that we would be having discussions about kind of the pitfalls of some of that. What was it that has been successful for some, or maybe what has kept them from going on with it? So this is something, as I mentioned, we're just starting out. We're about to start the contract with our 2 organizations, have had meetings with them. They're very excited about it. We're excited about the potential of what we can do with this, and plan to go forward with it for the remainder of our 3-year grant with ACL. That's what I had. Thank you.
Thank you so much, Alicia. And I hope you'll be joining our volunteer and faith-based learning collaborative. It'd be wonderful to hear more about the project. Next, our last speaker of the day in Bring, Brag, and Borrow is Jackie Haskell from Rhode Island.
Thanks, Jill. Hi, everyone. I'm Jackie Haskell at Centric Advisors, and we are a grant partner to the Rhode Island Office of Healthy Aging on the Lifespan Respite Grant. And today I'm really excited to share with you the toolkit that we've put together through the Lifespan Respite Grant about our student respite program. And I'll start with a very brief overview of the Rhode Island Nursing Student Respite Initiative and then describe our toolkit for spreading this program to other nursing schools. Our grant partners include most of the undergraduate nursing programs in Rhode Island, and they have each incorporated respite as a clinical experience for their students. And the students are matched with family caregivers through Care Breaks, which is a statewide caregiver respite program administered by Catholic Social Services of Rhode Island. And the students provide in-home respite, supervision and personal care for the care recipient and for family caregivers. And in addition to the break that they give to these caregivers at no cost throughout the semester, the long-term benefit of the initiative is that it introduces new nurses into the field of family and community-based care. So last year, all of the grant partners collaborated to complete a toolkit to help to spread this type of program to other nursing schools that may be interested. Next slide, please. So the first few key sections of the toolkit describe the ways that the participating nursing schools have incorporated respite into their programs. And they've each done this in different ways with their varying levels of nursing students who participate, from first-term nursing students in a 2-year program to upper-class students to registered nurses working on a degree. And they also serve different populations of care recipients. So caregivers of children, adults with long-term disabilities, and complex medical needs. And so this slide also shows the variety of courses that each school has used to incorporate respite into their curriculum. And since each school has taken its own approach, we organized the toolkit into 4 models for incorporating respite into the nursing programs. And each of the schools described their course content, their faculty's roles in the respite clinical placement, and clinical orientation requirements. And the toolkit also includes a description of the nursing program overall for each one, so that other nursing faculty can see, which of our schools might have some similar characteristics to their programs in terms of the degree programs offered, the types of terms and semesters, the formats of classes. And I think a strength of the toolkit is that it gives other nursing faculty a range of ideas and options for tailoring a respite program to their particular programs and students and caregiver populations. And so, for example, another idea that we included in the toolkit is one of our schools has group respite events for caregivers of children with disabilities. And so we also described this program in the toolkit as another idea. Next slide, please. And the last component of the toolkit that I'd like to describe are all of the resources that are included. The nursing schools provided examples of the forms and the respite orientation program that they have developed and continue to use. We also included respite referral flyers and applications from Rhode Island's Care Breaks program as examples. And we included evaluation materials as templates that we collect from all students and caregivers to track progress towards measurable outcomes. And those materials include things like pre and post surveys, the method for survey administration, and a data tracking worksheet. So in closing, this toolkit describes the key components of the program development and implementation for a nursing student respite program. And it includes tools and resources to try to make this an easier and more feasible process for other nursing schools that may be interested. Thanks for your time.
Thank you so much, Jackie. Everything you would need to start a similar program. I want to thank all of you for sticking to your 5 minutes because we're even a little bit early. But most of all, I want to thank you for being so generous in sharing all of the amazing work that you all have done. Speakers who spoke today as well as yesterday. I'm constantly amazed at what you all are able to accomplish and produce with these small lifespan respite grants and the partnerships that you engage with and the additional resources that you're able to leverage. It's just truly amazing. And we continue to inspire each other totally. So for everything that you brought and bragged about, and for all of us who are so lucky that we get to borrow everything that you've shared with us, we're extremely grateful. So thank you all very much. I'm especially delighted because we actually have time today for some live Q&A. Actually, Marcia, you can go back to the screen so we can all see each other. I think that would be nice. If anyone wants to unmute themselves and ask a question of a colleague that you might have heard something about today, or if you've got something you'd like to share quickly too, please feel free. This is our open mic time for the next 15 minutes. No questions? Comment?
Hi, Jill. Hi, Jill. This is Lita from Arizona.
Yes.
I did have a question for Mary in regards to the Native American caregiver curriculum. Are those the success of the training or the curriculum, has that been evaluated? Are there any, is there any data regarding that?
Hi, not that I'm aware of. I don't actually, I think the curriculum is relatively new, but I know that the Resource Center is very much into that type of information. So golly, you could certainly reach out to them and ask if they've had an opportunity to evaluate the success of the curriculum.
Okay, excellent. I thought the content was great, and I think, for many of our tribes in Arizona, they could benefit from the information. So thank you for sharing.
Yep, absolutely.
A question for Mary as well, because from Oklahoma, we are native rich as well in our state. On that curriculum, do you think that it would be pretty seemingly easy to move it over to other states and their tribes and their cultural differences with how the curriculum is wrote up?
It seems to be just, because it is almost clinical in nature, it seems like it would transcend through different tribal nations to me, but that would probably be a good question for the people at the resource center. And Jill, because we use lifespan dollars to make it an online version, it is available to everybody, right? Isn't that part of?
Anything that you're willing to share, and if it's yours to share, we'd love to share it.
Okay. Okay. And I'm sure they would. And I think once the audio is added, I think it's going to add a lot of richness to the video as well.
Thank you.
I hope I answered your question.
You did. Thank you so much.
Yes.
Any other questions? Susan and Cassandra, have there been any questions in the chat? I haven't seen any others. Just lots of wows and woohoos.
I'm not seeing any questions, but I just had a quick question for Jackie Haskell. She just presented about the Rhode Island program, which was one of the innovative and exemplary programs several years ago. And we don't follow up with those programs for 3 years. So I'm just like dazzled at what has happened in the last couple years. And so Jackie, what I was wondering, because the students are having the experience of being respite providers as their students, but when they leave the program, they're probably more likely to be in leadership positions rather than providing direct respite. So do you have any feedback from students about how that experience has changed them as they enter the workforce and their professional lives?
I don't think we have any more of that kind of longer term follow-up information, but that's a great idea. I think we'll try to think about how we can look into that. But I do know that, so even for the students who have completed their semester of respite, oftentimes they'll either continue on a volunteer basis afterwards, or they'll even look into, ways to become a, paid respite provider, so that they have, at least in short-term ways, definitely continue to provide respite. And all of the families have been, wanting to be able to keep working with that particular student, on their placement.
Okay, and that's interesting. So thanks. And I know you've replicated since Cassandra and I interviewed the program several years ago as an innovative and exemplary program. You had fewer programs then, so you have replicated within state, which is wonderful.
Yeah, it's great. We just had another one just start with their summer semester this summer.
Oh, fabulous. That's great.
Yeah.
Thank you.
Thanks.
Hi, this is Nancy Rinaldi in Delaware. I had a question for you, Jackie, also. Have you looked at any physical therapy or occupational therapy programs to do that same type of respite program out besides just the nursing programs?
Well, I don't think we have so far. For the respite offering that I mentioned, where they do a group respite for children, they do work with the physical therapy program at the university and offer it at their facility. And so I think they do have some students there that they participate in that part of the group respite.
But it hasn't been a program like you have in the nursing programs. You haven't worked with it. Okay.
Not yet. Yeah.
Okay.
But
I was
yes,
just
that's
curious.
a great other direction to go. Yeah.
Thank you.
Thanks.
Nancy, we do have innovative and exemplary programs that have worked with social work students and educators. So there may be pieces, if you're interested in replicating, there may be pieces that are applicable for therapeutic, OTPT.
Okay, great, thanks. I will check out the Arch website for that.
Yeah, and shoot me an email too. I can help put you in touch with people.
Okay, great, thank you.
You're welcome.
Our innovative and exemplary services also are required to provide a manual or a guideline for that would help with replication. So Susan you may have to contact Susan directly to get that information.
I was just going to add that one of the programs this year, the innovative and exemplary programs, uses students, but basically from any discipline. And what they're finding is that a lot of those students switch, they began going into the helping professions, or at least they continue providing respite because of the impact of providing care for adults with dementia has brought them.
That's a program from New York. It's really an excellent, completely inspiring program. Lots of lesson learned and very approachable. The person in charge is Sharon Leary, and again, anybody that's interested, go on the website. You'll be inspired. But I can also put you in touch with her. There's a lot to learn from her.
I believe that was also a program that New York gave a mini grant to through their lifespan respite dollars, to help stimulate that service.
Yeah, that kudos to New York for that.
Speaking of New York, I had a question. I'll wait and make sure that other people, well, since no one's jumping in, I wanted to ask Dina, and you may have mentioned this, Dina, I'm sorry, I was busy taking notes, but are you going to be sharing the Wisconsin Extension Service survey that you borrowed or that you adapted? Can you share that? And two, will you be providing some sort of document after you've gathered all the information on businesses and caregiving?
Yeah, so they, and correct me if I'm wrong, Doris, but I believe they agreed that, right, we'll be getting a report of all the responses. And of course, we'll have to analyze that. And I'm sure we'll probably draft something. But the survey's open. So we do, I think, have a PDF of it. And we made some, of course, some tweaks for it to be New York specific. We also took a very different approach. I don't know how many are familiar with Wisconsin and how they designed this, but it was really meant initially for businesses to register and then disseminate the survey. And our director, Greg Olson, he just really, he always is a big thinker and loves to just be like, okay, well, I don't want to limit it to the businesses who, want to undertake this. We want to put it out and make it available to all working caregivers, because it shouldn't stop them from completing the survey if their business isn't interested. So that was kind of what delayed some of the work, just in going back to Wisconsin and figuring out exactly how we were going to do that, because it was very different than what they originally designed it to be. I would say that we wouldn't in the future. I would think if a business was interested, in conducting one themselves, once we close this out, we would still then follow how they originally designed it and work with them. Because, the thinking was the connection with the coalition. They have so many valuable resources in training, in particular, like the caregiver simulation that could be done in follow-up and working with the business, So that was really, I will say, Doris's original idea. And Doris, I don't want to speak for you, you're on, so jump on. But when she had presented this to Director Olson, the idea initially was, hey, why don't we start in our own backyard, and will you be willing to ask the AAAs to do this? So that was kind of how it started, was because of the way it's designed. Doris thought, let's have the AAAs do this initially and see what kind of results we get. But in having that conversation, it just really blew up into something much bigger. So we're really excited about it. I will tell you, the first couple days of the survey being open, I think the numbers were a little lower than we expected. I want to say it was like 236 responses, and for being statewide and for the partners who are helping to push this out. I think we were thinking we'd see more. So we did just pay for a Facebook boost to actually, do some social media marketing with it. And I think it's being pushed on the next 4 Tuesdays at like 11:45 or something scheduled. So I hope that answers your question, but Doris, please feel free to chime in if you have more to add.
Let's see. I've been doing a lot of emailing back and forth today. Can you guys hear me? It says I'm muted.
Yes. No, we can hear
Okay.
you.
So what we're doing is working with Wisconsin, and I just learned also that Wisconsin is doing a statewide survey now that's modeled after our big statewide model, but we're working with Wisconsin to identify people or the organizations that have used the survey so far so that we can turn back around and reach out to all the organizations that we've invited who have not. So we're really looking for big numbers.
But just so if you all want background on this, which is where I think New York originally heard about it, we did a webinar a couple of years ago with Kristen Litzelman at the University of Wisconsin in the Division of Extension, and they make the employer survey available at no charge. And so you can access the survey and the background information from our website at the link that I posted, if anyone is interested in following up. But New York, as you said, has modified the survey a bit, so that would be helpful to see as well. Thank you, Dina.
I would just say that Wisconsin has been a great partner and they're very flexible. So it's a wonderful resource. You should reach out to them.
Yeah, to clarify, when you say Wisconsin, you're talking about the University of Wisconsin's Division of Extension, not the Respite Care Association.
The cooperative extension, right?
And again, we've got Kristen's information on our website. Any other questions? I was going to ask Dina the same thing. I wanted to hear more about what they had done with the Wisconsin survey. So thank you for asking that, Cassandra. Any other questions?
I just wanted to make sure everyone saw the comment from Nicholas Julian saying that a great way to boost participation is to offer all survey completions to be entered into a raffle. It's amazing how much more data you can get with a $300 flat TV screen. So, good comment.
On that note, if there's no more questions, then you can continue to chat with each other during the break, but we do have our break coming up next, our self-care break. You might want to, if you don't mind taking a second when you take your break we'd love to have you type into the chat some of your thoughts. If you could let us know what is one specific new idea, activity, or resource that you learned about during the Bring, Brag, and Borrow sessions over the last 2 days that you might use in your work. And many of you have already commented about that in the chat, but if you haven't had a chance to do that, please let us know. We want to know how and when and if you're going to be using the information you heard today. Dr. Lauren Parker is an assistant scientist in the Department of Health, Behavior, and Society at Johns Hopkins Bloomberg School of Public Health. Her research examines how home and community-based supports can be used to address the cultural needs of African American and Hispanic caregivers for people with dementia. With funding from the National Institute on Aging, she examines the influence of adult day services on the physiological and psychosocial stressors for African American caregivers. She's also the co-investigator on 2 NIA-funded research studies to culturally adapt the Adult Day Services Plus program for Spanish-speaking and African American caregivers. Dr. Parker serves on the Leadership Core Health Equity Task Force of the CDC-funded Public Health Center of Excellence in Dementia Caregiving at the University of Wisconsin. And I'm privileged to serve with Lauren on the executive committee for that project. She also serves on the research committee of the National Adult Day Services Association. And of course, for us, we are so fortunate to have her on the ARCH Committee for Advancement of Respite Research. Before I turn it over to Dr. Parker, I want to encourage you to put your questions and comments in the chat. We will be moving immediately after her talk into small group discussions on cultural adaptations and strategies for reaching diverse family caregivers. If we don't have any time at the end of her presentation, she may be able to respond to some of them during the small groups or by email. So now, without further ado, Lauren, I turn it over to you. And again, thank you so much for being here to join us today.
Thank you so much for the opportunity to be here today. I'm very excited to share something that I'm quite interested in, is cultural adaptation. So thank you. Let's get right into it. So I would be amiss if I did not acknowledge my funding sources. So thank you to the different funders. And I'm also acknowledging this work because I realized that I know several of you on here might be interested in aging populations, but some other populations such as younger adults or children might be in the population that's represented here. So I just wanted to say a lot of my examples are going to be about older adults and dementia caregiving. So just a forewarning. So the objective of today is just to discuss the importance of culture and define adaptations. And then I'll give a brief highlight from some of the work that I'm doing with culturally adapting the Adult Day Service Plus program for Hispanic populations. So when we think about culture and we're talking about this topic, I think it's important to center the conversation to really highlight the need. And the need is that in the United States, there's a growing number of racial and ethnic populations. It's expected that 1 in 5 Americans over the age of 60 will be over the age of 65 very soon. And then also in that population, we know that by 2044, that almost all Americans will belong to some racial ethnic group. So we're thinking that there's going to be a whole lot of older adults, and also that these older adults are going to come from typically underrepresented groups. In addition to the minority born underrepresented groups, we know that there's a lot of immigrants who are coming to the United States, such as African immigrants, those from the Caribbean, and those from all over the world. And we know that they're aging as well in the country. So in considering all of these factors, that people are aging, there's going to be a diverse set of people who are aging, it's really important to think about how those demographics are going to shape how we provide care and also accessibilities to different health resources. This is important because we need to start now thinking about how research can be changed, how practice can be changed, and how policy can be changed to make sure that we're providing the best care for all of those populations. So when I was putting this presentation together, I was like, oh, I should have a graph and I should show like all the different health outcomes and show all of these great figures. But I think that some of you on the call might be already aware of this, is that when we think about a lot of the top 5 health conditions in the United States, we know that by and large, most racial and ethnic groups have higher prevalence of a lot of the disparities that we see. My health outcome of interest is dementia. And so when we look at dementia, we know that African Americans and Latinos are nearly twice as likely to have dementia compared to those who are white. And we know that there's a lot of reasons why people have health outcomes. This could be something like cardiovascular disease, it could be something like obesity, and it could also be things like health behavior. But we know that it's not a proxy of someone's race or ethnicity is the reason why that they might have some type of health outcome. We know that health outcomes are also shaped by their experiences, their lived experiences. A lot of people are using the word social determinants. And so where people live, where they play, and where they grow really shape their health throughout the life course, and how they access health services and also how they access health resources. So we know at the center of health disparities, there's more than just race. And one thing that might also be at the center that it can explain health disparities is culture. Culture might be a reason why we can understand some of the disparities we see. And also, if it helps us understand the disparities we see, it might help us inform how we can change our care to provide quality care to those populations. So I'm using a lot of words, but I'm not giving an example. So when we think about health services, specifically for people who have dementia, for example, we know that racial and ethnic caregivers are less likely to use formal care services. So my favorite health home and community-based resource is Adult Day Services. We know that typically people are not using adult day, and it could be for a variety of reasons, such as paying for it, having accessibility to it, but some other things could be at play too. We know that certain groups, such as African Americans, for example, are more likely to rely on friends and family. So the family network to provide care instead of sending someone off to be cared for someone else. So that's an example of a cultural explanation of why we might see some type of disparities in different health outcomes or health outcomes and also use of health services. We also know that cultural norms and values play a variety of roles in society and how people interpret and use different types of health resources. And so in some of our work, when I, for example, when I speak with Latino populations and care providers for Latino populations, people might say things, care providers might say things like, oh, when someone comes in to seek services for Latino clients, for example, there tends to be a large number of people who might come to the service to the doctor or the adult daycare appointment for the initial visit, because there really is a strong reliance on family. So those things are important to consider. So I've said a lot about why culture is important, but I really didn't give an explanation or definition for what culture is. So culture is an ever-changing set of symbols, beliefs, and customs. So what one thing might be culturally represented today might not be something that's culturally represented tomorrow. So it's ever-changing. Culture and cultural frameworks are endorsed by those people with similar or the same beliefs, symbols, and customs. And culture is very important because it's learned through interactions with others. And it's something that is authentic to the internal workings of the culture itself. So me as an outsider, if I go into a culture, I'm trying to understand a process, I might be able to look and maybe identify some things, but I really can't get a clear understanding until I talk with a particular group about what are their cultural values or norms or organizational structures. So the topic of today is culture adaptations. So it wouldn't be fair without talking about adaptation. So adaptations, when you think about adaptations, adapt is at the center of it. So when you think about adaptations, the principle is that adaptation is inevitable and is necessary. Something can't go on the same all the time. You have to make changes as needed. A clear adaptation to a lot of our work has been because of COVID. I am an instructor and I teach classes, and this year I was all set to have a course this year and I was teaching in person. But because of COVID, we had to change everything and make it into a Zoom or a Zoom format for the courses. So that's an example of adaptation in a simple sense. And that's when we think about interventions or different types of evidence-based programs to help caregivers, for example, we know that things change and we can't control it. They just happen to change. So the science of adaptation is always evolving. One thing that is important and is really critical about adaptations is that a health equity lens can be used to guide the adaptation needs. And this is particularly important when we think about racial and ethnic community. Sometimes, for example, in some of the research I'm going to discuss later is that things like language might be a factor. When some types of programs or services are offered, they're not considered, or most of them have are framed in the context of being like an English only spoken or delivery package. But we also need to be mindful about how language, for example, can be used and is needed. But when we think about language, we need more than just actual translation of language, but what is the words and symbols that we're using in adaptations? I'll go into a little bit more of that later on. And the thing that is crucial to adaptation is that it's an iterative process. So you might do something one time, but things might change. It's ever changing over and over. And the great thing about adaptation is that you can always evaluate the process, adapt again, and start all over. So I briefly touched on all of these things about how adaptations are changes. Some of these things can be accidental changes to the intervention or to a process or program. You might just, for example, people might have read that the program's supposed to be done in 9 sessions, but someone might have read it wrong and it's 8 sessions, and they've been doing it all wrong, unattended the whole time, but maybe there was some benefits of changing it from 8 sessions to 9 sessions, even though it might have been accidental. And adaptations can occur at any point during their implementation period. This can be prior to, during, and after. And it's important to really monitor and evaluate when implementations are taking place, because it might have an impact on the delivery and the outcomes that you see. So here's an example of adaptations to evidence-based programs. And when adaptations or what type of adaptations can be taking place. I won't go through all of the examples on this chart, but for example, an adaptation that can be made prior to implementation is the changes in the number of sessions. I know that many of you all who are on the call might work for a state organization or a state-funded program. And so me as a researcher, I might say, when I'm out in the field doing my research, I notice if you can do 12 of this great intervention that I developed, it's awesome, it's great. We really need you to do 12. But in the practice, 12 might not be feasible. It could not be feasible for a number of reasons, such as staffing. You might not have enough people who can devote enough time in terms of staffing to do a 12-session program. It could be in terms of the economics, paying for a 12 session, the space, the snacks. I'm a fan of snacks. The snacks needed to have 12 sessions in person, or just people's interest might not be for 12. And people, when you're in the field, you know your population better than someone like myself who's developing interventions and excited about all the great possibilities. It just might not work. And so prior to implementation, the number of sessions can be changed. So going from something like 12 sessions to going to something like 8. During implementation, some of the changes that could be made are provision of additional materials. I've seen and have been a part of a number of studies, for example, where we've provided a whole bunch of materials. We're like, okay, this is great. This is all you need. And then when we're talking to our interventionists who are carrying out the interventions that we've created, they're saying there's not enough information. We need more detail. Can you provide more information on this particular aspect of the health outcome? So that's an example. Following the implementation, I think that modifications to documentations are great. And that's a really great example, because you might realize that you don't need as many documents. Or when you have your documents, you might realize that some things that you thought that you worded correctly aren't necessarily clear, and that by going through the process of an entire intervention, for example, or health program, you might realize that some things can be taken out or enhanced. And then lastly, an example of some type of adaptation that could be made prior to scaling up or disseminating this to a larger population is shortening the training of staff. You might not need as much time with staff development and training. So when thinking about adaptations, specifically to the health context, there's a number of things to consider. One is that you should address the caregiver and the staff's perceptions of the outcomes. So some people will say, there's nothing we can do, there's nothing that we can change. But some adaptations can be made, but it has to be specific to what is the outcome of interest to both parties, the caregiver and also the staff. Also, it's important when thinking about adaptations to provide basic disease education. I know that, for example, in adult day service programs, the staff are so, I don't want to use the word burden, but their day-to-day schedules can be so ever-changing in terms of making sure everything's are correct with their clients, making sure everything at the staffing level, also making sure everything is correct at the board's level in terms of training. Things might change. And sometimes staff are just not educated on the most up-to-date or current science on a particular disease, in this case, dementia, for example. So providing basic education or ongoing education is important when developing adaptations. Also, streamlining material and training to fit limited staff time. We are currently having a lot of training going on for adult day services, over 40 adult day service programs across the nation. And so we really had to be mindful about how we put together our materials and our training. So it would be nice if we could have weekly phone calls for an hour and a half, but that's just not feasible for a lot of the staff at adult day service programs. So really just being mindful about what is a centralized place that the information can be stored. Can it be stored in a cloud somewhere? Could it be stored in the actual facility that you're using? But streamlining all materials and training to make sure that most people get the most benefit out of it and you have people there at the same time. Also, reducing or flexing the number of sessions and or the length of time to align with caregivers and staff schedule and workflow. Time is our most valuable asset. Anything that can be done to reduce things, having trainings going from 12 to 8 sessions where it's appropriate would be great. Costs. costs. I wish we could just go pick money off the tree, but identifying the cost saving methods and payments to delivery are so helpful, especially times now where it's a flux with COVID going on, and thinking about how are things being paid for and how people are utilizing the payments that they have. It's important to consider all costs from when you're implementing a program, when it goes to the prior to implementation and also after the implementation, and think about how this can be sustainable. And then lastly, it's important to link outcomes of existing quality measures to regulated long-term care industry. So for example, hospitalization is a huge hospitalization and rehospitalization is a huge outcome in long-term care industry. So for example, if I was developing or creating some type of health intervention for an adult day service program or for a long-term care facility, for me, it would be really important to link the outcomes related to my intervention related to hospitalization and rehospitalization, because I know that's important to the long-term care industry. And so these types of outcomes might be different for the specific population that you have, but it's important to be mindful about how you can link what your intervention is doing to long-term care, for a specific care industry, so that you can show the value in the intentionality of doing the intervention or health programming that you have. So that is a lot about culture, and that's a lot about adaptation. So putting that together, we have cultural adaptations. So cultural adaptation are systematic modifications of programs. So considering how language, culture, context, in meaningful ways meet the client's patterns, meanings, and values. So an example that I'm going to provide in the upcoming slides are talking about how we adapted a program for Latino caregivers and how we were mindful of language, for example. And so I'll go a little bit more of that when I give an explanation or case study. Cultural adaptations explicitly address the cultural patterns or values at the client, provider, and socio-political level. And it also is important to consider socio-historical factors like medical mistrust and stigma. I have a great example of that. I live in the greater Baltimore area, and there's a lot of distrust, for example, with people who use the Johns Hopkins medical system among Black and African-American clients, because Hopkins in the past didn't have such a great name with how they provided care to that population. So there's a lot of work at Johns Hopkins, for example, about how to provide meaningful care and how to be engaged and beyond showing compassion and being authentic, but really working to restore their name and trust in the community so that people feel comfortable with seeking health services at Johns Hopkins. And this is just an example of Johns Hopkins, but this is an example that could be provided at a number of different health service providers and also different hospitals. So it's not something that's just specific to Hopkins, for example, it's just an example. So it's important to be mindful for terminology. So I gave a definition of what cultural adaptation is. And sometimes when I talk to people, they're like, oh, I'm doing cultural adaptation work. And they might be doing things simply as just changing the language. But cultural adaptation is more than changing the language. Changing language is fine, but that's not necessarily cultural adaptation. Language only, for example, could be something that's considered cultural attunement. And that describes the additions to evidence-based interventions that are intended to boost engagement and retention of subcultural group members. So changing a program to a native language, utilizing bicultural staff, and incorporating cultural traditions. Those are some small examples and tweaks, but that's not true cultural adaptation. But attunement is really important because it identified changes is to increase reach and also to increase engagement, but it does not modify the core treatment components of a particular intervention or care strategy. So I get to talk about one of my favorite things, which is my research and this great work that we're doing in the community. So this is the cultural adaptation of the Adult Day Service Plus program. This is our lovely logo that we have. So the Adult Day Service Program is a research study, but we're really focused on how can we improve the well-being of persons with dementia and their family Caregiver. So what we do is we partner with adult day service programs throughout the country. And these programs and caregivers who are in this study, they're already utilizing adult day service programs. We're just giving them a little bit extra. And that little bit extra is education and skill building opportunities. And we offer strategies to enhance the caregiving experience. So in order to be eligible for the Adult Day Service Plus study, you have to be a caregiver, as I mentioned. You have to use adult day services programs for at least one time a week. There's a whole bunch of other eligibility criteria, but I just want to point your eyes to the fact that you have to speak English. And this is when we first started the study. And this is a 5-year study, so we're in the 5th year. So when we were going out in the community and we're realizing we had a limited participation among Hispanic and Latino caregivers, and we're like, what's going on? So I visited several adult day programs in Miami and California, talking to different people, and they all said the same thing. Well, you say we have to speak English, and some of our caregivers just don't speak English. And that's a true eligibility criteria. So we came up with the idea of, well, we need to change it. We need to take our language requirement out of our recruitment material, and we need to think about how we can change our recruitment material to translate everything into English. Also, we had issues with staff turnout, staff burnout, and also a lot of people, this is their first time participating in the research study, but I won't go into all those details unless you have questions about that. So some of the solutions and some of the work we did, this is a picture of me with some of our friends down at Eastern Sills in Miami. We really had to do targeted recruitment, so relationship building with the research liaison, so the staff of the adult day service program, and also engagement with the caregivers at the adult day service site. So we applied for additional funding, and we've translated the adult day service Plus program into Spanish. And so in addition to changing things into Spanish, we had to be mindful about our recruitment material. And so we've had to change all of our recruitment material really to enhance it, and also the other components of our study. So being mindful about how we're including and incorporating culture into the work that we're doing. Some of the examples and some of the activities that we engaged in are doing focus groups, for example. And it's really interesting. We were putting together we're currently putting together a recruitment video, and we're having animation figures. And so we were trying to think of examples to describe dementia behavior. So some of the common ones are people become aggressive and wondering. And so we were putting together different focus groups, and we're saying, well, what's a Spanish word for wondering? And meeting with our research liaisons or our focus group members, we were talking with them, we were asking, well, how do you say wondering? And for us, we didn't even consider the fact that there's no one-to-one definition of what wondering might be. So in the English language, when we're talking about wondering, we're referring to someone who might leave the home and just go outside, for example, and just leave and just wander. But learning from our focus groups participants, we're realizing that might not be a clear way of explaining it. So those little small nuances are some of the examples of how we were mindful about how culture is important to include and to explain in order to encourage participation. So I know that time is running close. So this is just some of the steps that we took to culturally adapt our program. So our first phase was to translate and adapt the Adult Day Service Plus program based on our stakeholder needs. So some of the activities that we did were, of course, translating the material and also conducting focus groups. So the second phase was preliminary adaptation and tests. So conducting focus groups and also using the feedback that we gained from our focus groups to change to inform our manuals, our intervention manuals, and also our recruitment material. And then we've pilot testing or in the process of pilot testing that information. And then the last phase of our culture adaptation is to tailor all of our study related material based on what we learned. And this process is rooted in something called the culture adaptation process. And these are the 3 different phases. Here are some of just the research activities. So it's 3 phases, and it's really important to keep the conversation ongoing with those who are stakeholders, just to be mindful that you are adequately addressing and capturing all of the things that are important to the stakeholders so that your intervention, for example, or care plan or program that you are adapting can be the most appropriate and tailored to the population that you're interested in. And lastly, just some key points to think about as I close. It's important to understand how cultural norms and values help shape the ties that exist within racial ethnic population. And then in addition to cultural norms and values, I really want to point out and really highlight that it's really important to think about how structural barriers in society really impact and shape some of the health disparities that we see, particularly among racial and ethnic populations. And the last point is that adaptations are never ending. It's an iterative process that happens at different points before, during, and after. So if you are doing an adaptation now, you're like, oh, I heard this and I didn't think about, as you're going through this conference today, you didn't think about one point. It's okay. Don't beat yourself up because it's always going to change. Things are ever changing. I would love to take this time briefly just to give a shout out to the Public Health Center of Excellence. It's at the University of Minnesota. This is an excellent resource for people who are on the call who are whose populations are those with dementia. We provide a variety of resources to state, tribal, and local public health agencies to really enhance dementia caregiving focused programs and initiatives. We provide different types of trainings, we provide best practices, and we can connect you to a variety of resources. So I would highly encourage you all to visit that website if this is a population of interest. Also, I just want to give a quick plug is that we have a culture adaptation series going on, and we have 2 other webinars coming up in August and September that'll provide some more information about culture adaptation. So please be on the lookout for that and visit our website just so you can stay engaged. At this time, I will take any questions if we have time for questions. And thank you so much for the opportunity to be here with you all today.
I think we can take 1 or 2 questions if there are any. Anyone want to unmute yourself and ask a quick question? I don't see any in the chat right now. But thank you so much for that excellent presentation, Lauren. You really gave us so much food for thought to reflect on, as well as what I think was really helpful, all the practical steps that are needed for undertaking service adaptation. And to see how it's all working in your research study too was incredibly informative. And fortunately, right now we have that opportunity to continue the discussion, and people may ask you questions in the small groups. If that's okay. We will go right into those small groups. As I mentioned earlier, we're flowing right from Dr. Parker's presentation. The topic is cultural adaptations, and the purpose is really to learn about all of your successes and challenges related to reaching and serving caregivers with culturally diverse backgrounds. I was really delighted that we had several excellent and very timely presentations today from states that are doing exceptional work in this area, especially around outreach and even in adaptations. And I hope we'll have a chance to hear more about those in the small groups today. I think what I learned, I'm going to let Lauren do the main points from our session, but what I learned that was so spectacular that I just want to share right off the bat is that I was impressed with what folks in our group were already doing around outreach to diverse populations. And so we had a lot of success stories. We did have challenges mentioned, but lots of great ideas for reaching diverse populations, and I was really happy to hear that so much is already happening. Why don't we start with Susan's group to do some reporting back.
Thank you. Our group was amazing. Wide participation, really deep, nuanced discussion. So I don't know if I'll be able to capture it all. People have tried things, and they talked a lot about some of the challenges they met with. So let me try and capture what I heard. Well, in terms of the question about taking first steps, Ronell in Oklahoma talked about the importance of meeting with groups, not assuming to know about that group, learning from the group rather than about the group. And Nick Sons from Virginia talked about the importance of identifying which groups you have in your state, sort of like what we heard about this morning from Washington, using even existing data to find out who you should be serving and who you're not serving, who you're missing. Nick also talked about, he went to a coalition meeting this morning and they had a presentation from an African-American woman who just finds herself as a cultural broker. And she, interestingly, she had a child with a disability and went to the usual resources to find out how to navigate the system, but she was the only African-American person there and she didn't feel a part. And so we talked about like how, even when we have mechanisms for parent-to-parent communication or to join, they're not necessarily culturally sensitive or inclusive of everybody, and we shouldn't assume that they are. Mary Welts in North Dakota talked about the challenges of working with tribes who used some of the same pots of federal money, but didn't speak the jargon, didn't have the same bureaucratic understanding, you know, like middle-class white to middle-class white, we could throw around title this and title that and matching funds and all these things, all this shared knowledge. And we can't assume that other people know that. So Mary, you know, had some really sensitive notions about how to start the conversation and to talk with people. And the notion, Lauren talked today, this really caught my attention. This came up again and again in our group. The notion of attunement, of increased reach and engagement. She talked about relationship building, and that was really huge in our conversations. Oh, this was brilliant. Alicia Blader talked about that they have Spanish translations and they have online referring agencies that help families navigate the respite voucher system. But the attunement is really difficult because even though they have the translations, the people doing the navigation don't know the culture and don't always speak the language. And so she talked about like intending to do something good and feeling uncomfortable about how much good they're actually doing. And like, it's difficult to gauge when you don't have an understanding of the population, when you're not attuned. Ronell talked about what a difference it made in Oklahoma when they hired somebody who Ronell said built a brilliant bridge with Spanish-speaking communities, and that she essentially worked as a cultural broker, and the importance of having people who know the culture actually in those direct service and in leadership positions, to the importance of that for attunement. Oklahoma is going to do a cultural self-assessment, so I just already recruited them, Jill, for a focus group. And then the other thing that Alicia Blader was talking about in terms of successes, they work closely with the Office of Rural Health. They have loose associations with Hispanic and historically Black churches. And what Alicia said, I thought was also really brilliant. She said, we want to be as good a partner with them as they are with us. So those churches tend to, like, everybody goes to them. So they're seen as the sort of representative of the culture, and everybody wants something for them, but they don't have the infrastructure or resources, deep resources, to be able to give constantly, to be the expert for everybody in the community who wants to learn from them. And so again, that notion of attunement, that we feel like we're giving something meaningful back to those cultural communities we want to learn from. And where to start, we talked about like where you start with all this. And then Megan in Colorado talked about finding the places where the underserved congregate. Sometimes we don't know where to look. So starting to look for places where people go for refuge and people of like minds, to engage them. And then just to end what we talked about, this, I'm just barely skimming the surface of the conversation, but a number of the people in our group were in rural communities, and they talked about the digital divide, which is real. So social, we all talk about social networking, and we've been living on Zoom, but we're leaving a lot of people out. And so we just need to pay attention to that when we're talking about including people and reaching underserved populations. Before I go, group, did I miss anything really major here? My wonderful group. Thank you. I didn't do them service, but it's recorded for posterity.
Great, thank you, Susan. It sounds like a wonderful discussion.
So good.
Cassandra, you want to report out from your group?
I'll be happy to. I had an amazing group. So I challenge you, Susan. We were just as good as yours. And I'm certain everyone was as well. There are a few themes that came up repeatedly, and I'm just going to start with the theme I wrote down as people, that we must listen to the leaders in communities. We need to reach out and get the tribal elders, the church leaders, whoever is living in that community, we must engage and listen to them. That if we're doing cultural adaptations to tools, for example, and we need them to be linguistically correct, we need to engage the bicultural, bilingual people to help us with this, because there's no one-to-one translation most of the time. I mean, a lot of our discussion was about learning from people in the culture, hiring them. If we're using volunteers, we want volunteers from that culture, because we pretty much nothing about, we didn't say it, but as I said at the end of our group, we're talking about nothing about us without us. Involve the people from the culture in everything you do. There were some great programs I learned about from my old hometown of Wenatchee, Washington. I learned about the Brave Warriors, who this is a project that is really assertively going out and linking people from different cultures to services and making sure that everyone is served. And I'm hoping that Barb maybe can share a little bit more about that. Barb is our note taker, and I was hoping that she could share a tiny bit about that. What's really critical is always to develop trust. Part of the development of trust is making sure people are engaged, are involved from the communities that you're trying to serve. A wonderful thing that Alita said, I wrote it down, it was so good. She said, with her Grandparents Raising Grandchildren program, she says, never promise everything, because as soon as you break that promise, you lose trust. And that just really resonated with me, that you only promise what you really can deliver with any group of people. She was talking especially about grandparents raising grandchildren, but I think it applies everywhere. You don't promise what you can't provide. The other thing about getting started, people really said, know the demographics of your state and your local community, and then compare those demographics with your service population. If there's a disconnect, meet and decide what are we going to do. Do a lot of self-reflection as a staff about where your shortfallings are. Why aren't we serving the population proportionate to the statewide demographics? And Barb, could you just, I want to be mindful of the time, but could you share a little bit about that Brave Warrior? Do we have time, Jill? Okay.
Thanks, Jill. Yeah. So Brave Warrior Project is a rather unique program for children and possibly young adults who live in that part of Washington state, which is not deeply provided with different types of services. And when they agreed to become a lifespan respite voucher, approved provider, they realized that there was the opportunity for more people in the community to use their services. So it was a win-win. They are growing their project by reaching out to the Hispanic-speaking community in that area and navigating the application process for the voucher, helping them, get onto the program and working with us to make sure that people were able to go, through that. They also, just informal discussions with their staff have helped me to understand a lot of the barriers that families in that area have, and to learn more about their, how they walked people through our application process, which is all online. I learned about homelessness in the area and literacy issues and just all kinds of barriers that they're deeply aware of, because they're right there in the community and they have staff who are members of that Spanish-speaking community. So anyway, they're a very interesting program. They are a bit unique. Out of, there are other programs like it in the state, but it's not widespread. And the families love it. The kids get dropped off and it's great.
You reminded me of something Marilyn has talked about, and that is that whole navigation. Peers from their own community, helping them navigate services. So I think that's another thing, the one-on-one, I think she called it the high-touch navigation services. So I'm going to be quiet now and thank you. A wonderful group.
So great discussions. Ray?
Thank you, Jill. Yeah, after my omission yesterday of getting a note taker, I was fortunate enough that Tracy was in my group today and she volunteered to do it again. So I know we'll have excellent notes to capture this, but the conversations in our group focused, I think, primarily in on the areas of identifying successes and challenges from folks who had actually tried to do or had done some adaptation, and because there were a number of folks in the group who had done that, and there seemed to be four. I'll call them big buckets where the comments fell. They included ways to engage with communities, ways to share experiences, both successes and challenges amongst the rest of us who are trying to affect cultural adaptations, specific challenges to adaptations, and then a new one for at least I believe, I don't think it's been raised before, and that was regulation or regulatory administration, which could be a particular barrier. And as examples for ways to engage, Nicholas Julian suggested that he'd had success by convening a multicultural advisory committee populated by members from a number of communities that he's been trying to serve, and that efforts to engage with communities were all run through that committee, so that the committee itself has credibility with its member communities in the service area, and that opens doors and creates a bit of credibility out of the blocks. Another suggestion was made, I think Val from Wisconsin suggested that you identify trusted organizations or groups within underserved communities to approach to help you make contact, so that you're not trying to do it on an individual client level, for example, but get advanced awareness of who you are, do the front end work with trusted. It's like the research ambassadors that we talked about in the research community. Ways to share experiences. You're going to love this, Jill. It was suggested that Arch host a blog that people could post and access, or perhaps form another learning community around cultural adaptation issues. Challenges to adaptation. One that was pretty interesting was the issue of translation of materials into different languages. There are nuances that don't always translate. There's dialectical issues that don't always translate well. And the point was made that even if you translate things well, you can't always assume that people who don't speak your language are necessarily fully capable of participating or understanding those written materials. They need to be literate in their own language and cultural context in order to take value from those. So that was an interesting one. And then the one that was, I think, unique to the conversation so far that I've heard across the 2 days is the idea of regulatory restrictions. If you are in a service environment where you're not allowed to use volunteers, where people need to have evidence of training or represent or be provided through an agency that may need to have a license or a certificate, that's another layer of challenge that needs to potentially to be overcome. And there were a couple of rather compelling examples there about providers who weren't allowed to serve even a family member because they had a criminal background and the state couldn't pay them, for example, things like that. So that struck me as a unique and new area that we might have to pay attention to in doing cultural adaptations, that regulatory programs do exist and may impede some of our efforts. So Tracy, did I get it right? Did I miss anything?
Awesome job, Ray.
Okay, we had a great group. Thanks, Tracy.
Thank you all. That's wonderful. I just got a message from Lauren, who was facilitating our group, that unfortunately she had to jump off the call. I'm sorry. I wish I had known that. I would have let her go first. But I took some pretty good notes in our group, and a lot of what we discussed was already mentioned. Primarily that successful strategies include finding a champion or an organization within the community that you're trying to reach to help you do outreach to that community was really critical. I was interested to hear that in New York, and Doris Green's agency, their lifespan agency, which is different from the lifespan respite program, which just happens to be called Lifespan. They actually, on their intake lines, and Doris, correct me if I'm wrong, can respond to folks calling in almost any language. You have enough interpreters to respond to whatever language someone is calling in to?
Well, no, it's a service. We pay for a service.
Oh, okay. Sorry.
And it's accessible to any employee.
Is that
and
a local service?
I've used it multiple times. It's really quite simple and helpful.
Is it a national service or is it just local to New York?
I'm guessing it's national because it's every language you can think of.
Oh, interesting. Does anyone else use that service?
Yes, in Washington State, we use, for our whole organization, we use Language Line. It's national.
Oh, I think that's what it is. Yeah.
Okay, something new I learned today. That's really great. When we came to other successes, and again, we really focused on successes because we had so many very experienced folks in our group. Several states that deal especially with Native American populations and have been doing so for quite a while. So it was great to have their expertise. But Cheryl from Nevada, who ran that wonderful prescription respite RX program pilot that was so person and family centered. When you're doing true person and family centered services, you're sitting down with the family caregiver to find out exactly what respite services would best meet their needs. So that's a wonderful way to make sure that what you're providing is culturally relevant to that particular family. And of course, the self-direction component too, where they're able to hire family and friends that they trust the most, really helped encourage otherwise underserved populations be more willing to accept respite services because they could choose from their own networks of providers. Let me see what else I had in my notes. I think we also talked a lot about what do you already have in terms of what first steps, could you take if you're just beginning the process. And I was interested to hear that if people were situated in their state agencies, they're already receiving training on culturally diverse groups from within their state agency and how to be sensitive to cultural groups. So that was great to hear. I didn't know that happened across states and within states, that kind of training was that available. And that I think some of the final words, one other important point that Cheryl made was that sometimes we get so caught up in, or state agencies with a lot of money get caught up in serving as many people as they can. Let's serve more and more people, that no one focuses on who is not being served. And so we often miss out on a lot of groups that are underserved that we could be serving. And then words of wisdom from Patrick in Montana: keep plugging away. If something doesn't work, keep trying, because it's really worth it and it's necessary. Anything else that anybody from my group wants to add? I'm sure I missed a lot of very important points. And it was wonderful to have some examples from Lauren too about cultural adaptations, and again in her ADS services for Hispanic and Black and African American populations. Anybody from my group? Did I miss anything? It was a lot of great discussion, and I felt like I was in a room full of experts, so it was really wonderful. I just want to mention to all of you that we're exploring maybe doing some more work with Dr. Tawara Good at the National Center on Cultural Competence, specifically because after she did that wonderful webinar for us last summer on cultural and linguistic competence in respite services, there were a lot of questions about how can we do a self-assessment for our own agency, for our coalition, for our respite service. So we were thinking of devoting some time and resources to building a self-assessment tool that would be specific to respite services. And I just would hope to hear back from some of you if that would be something that would be useful and helpful to you. And I can get you more information about what does it exactly mean to have a self-assessment tool. But the wonderful thing, the way that she would approach that is by holding focus groups with all of you to find out what it is you all need, and then building the self-assessment tool based on your identified needs. So you can either write in the chat, yes, that's something we'd be interested. No, we're way past that. We're already reaching groups that we need to reach in our community. We don't need any help. Or give me some sense of how you would feel about training and technical assistance in that area. Or email me and we can talk about it some more. So we're way past time and I don't want to keep you any longer. I just really want to thank all of you for such a great couple of days and for sharing, again, your ability and your generosity in sharing what you do and your tools is beyond comparison with any other national organization I've ever been involved with. So thank you for that generosity. And for taking the time out of your schedules to be here for so long. Please respond to the evaluation survey that you're going to get in your inbox today. It really will help us begin preparing and planning for next year's event, and we do start early. And we hope that that meeting will be in person, and we hope it'll be in conjunction with the next National Lifespan Respite Conference. Again, so thank you everyone for those of you who have hung out with us for so long, and drop us, any one of us, a line or contact us by email or phone if you have any questions or a topic of training and technical assistance needs that you have. We're here to respond to you at any time. And please contact each other as well, because we're all to each other the greatest source of information. And Lori also very accessible, still on the call with us. Thank you, Lori, for your time. Oh. Thank you, Arch staff. We'll see you all hopefully next year in person, but certainly by Zoom call before then.
Yeah.
Have a great afternoon.
To see everyone.